Happy New Year, everyone, and thank you for joining us. I'm so pleased to welcome our faculty and professional staff to this virtual town hall. I hope your holidays were a time to relax with your family and refresh for the new year ahead of us. This month, we're embarking on the next phase in Drexel's response to the COVID-19 pandemic. This is going to be a time when we hope that many more of you will be able to join us back on campus. Some of our faculty will teach in-person classes, and others will be able to work with students in a lab or studio setting. And a number of our professional staff will return to their campus offices for the first time since the pandemic began. As we welcome our students back to campus, I also want to acknowledge how difficult this past year has been. I know how hard you have worked to keep Drexel moving forward, despite the many challenges you have encountered. Through it all, I know that you've also had to deal with your own stress, anxiety, and heartbreak associated with the pandemic. So once again, I sincerely thank you for all that you've done to support our university, and especially our students and their families during this trying time. Today, we're going to talk about some of the steps being taken to safeguard the Drexel community from the coronavirus. You'll hear about our COVID-19 testing program, and we're going to stress that each of us plays a critical role in the collective health of our campus community. This means we all have to keep wearing our face masks, maintaining safe distances, and washing hands frequently. And we should all perform a daily symptom check-in through the Drexel Health Checker app. The university has prepared extensively to support the health of our community, including comprehensive testing, contact tracing programs, and added safety protocols. That's why it's so essential that we all embrace personal and collective responsibility and follow public health guidance to have a successful winter term. Now we're going to hear first from Dr. Marla Gold, who heads our Return Oversight Committee. Later, we will respond to questions. Anna Kulis from the Drexel Solutions Institute will moderate that part of the meeting, and she will introduce our panelists for the question and answer session. So Marla, over to you.
Hey, everybody. Thanks for being here at our Health and Safety Town Hall today for employees. We're going to put up some slides and talk through the kinds of things that we're continuing to do on campus. And then I'll be followed by Dr. Janet Cruz, who will talk a little bit more about our testing program and some other things about health and safety. So let me have the first slide. So a reminder where we are. Our winter term plans have been fully approved by the Philadelphia Department of Public Health. First, let me say, to be inclusive as possible, we use the term winter term. I'm talking to all of us. So that is semester people on different calendars, also our quarter folks who are coming in at different times. Athletics plans have been approved also by the Philadelphia Department of Public Health. So Tier 1 sports such as basketball and potentially even wrestling go through a very rigorous review by the department, and then we're told if we have permission to move forward. And you can see that basketball teams, men and women's, have been playing. Our facilities have been readied, HVAC systems all reviewed and addressed where necessary. And a reminder that the College of Medicine, the College of Nursing and Health Professions, the Klein School of Law, our graduate and research programs successfully ran without interruption the first half of the year, particularly the first quarter, and they are continuing currently. Overall, our fall test positivity was at or below 2%, except, I note, post-Halloween and Thanksgiving. Currently, as I'm talking to you today, the state's running about 11 to 12% positivity. I'll talk about the significance, and the city around 8 to 9%. We'd like all of us, the World Health Organization wants us well below 5%. Next slide. So this is the Drexel Dashboard under Health and Safety on our Return to Coronavirus website. You can access it, and you can see we put up our most recent week, which includes the weekend, and we're beginning to ramp up much further, and you can see that by the information public. And you will see in the line that it says screening test, 2,341, 31 positive, or a 1.6% rate. And then you see symptomatic, and those are people who don't feel well, have symptoms, or they know they've been exposed. You will always see a higher percent there, as we have said in other town halls, and this is true of dashboards all over the country. And so we roll those together, showing you a 2.2% positivity. And these data sometimes change a little bit because COVID data sometimes is delayed coming in. So please know if you see switches, that's what's going on. And on the right, you see it just displayed differently. Next, please. So another thing that you can see on our site is this, on the dashboard, is this line, well below 5%, but you see that peak at 3.5% on November 15th. That represents Halloween, and as high as 4% actually speaking to Thanksgiving. We've gotten a lot better control in our knowledge about what all of this means as we go and test more populations on campus. Most recently 2.2%, and I would tell you that it's exceedingly low for the students who began to move in over the weekend, and we'll hear more about that when Subir talks about student life. Next slide. So you'll see these signs all over campus, and they should be familiar to you. They were also print out and block on cards that were with masks. If you haven't gotten them yet, you will once you're back on campus. What are the mainstays? There's no magic here. They are similar at all institutions of higher education. We're doing it our Drexel way, and we're pushing out things as fast as we can and being ready for you. We have a mandatory health and safety online training. It is constantly revised and has been revised for all of our employees to make sure that you take. Embedded in that is the Dragon Pledge that we accept collectively. You can see it's written more with students in mind, but we were doing this as a campus community when we accept it. And just like the signs show, face masks are absolutely required in Drexel buildings. You'll see most people wearing them outside as well. A lot of us who worked on campus this weekend were pleased at the mask wearing that's going on. Washing hands frequently. We have sanitizer stations all over the campus. We're testing them continually. John Chase and his staff are constantly filling them. Absolutely to stay home if you don't feel well. And of course, to maintain distance at least 6 feet apart. And you'll see these as reminders all over. And more recently, we've added COVID testing availability for students who are in mandatory testing programs and employees where we offer testing. Next slide. So just very quickly, and Dr. Cruz will get into this a little bit more, a reminder, COVID screening is but one part of risk reduction. Please wear your masks and abide by all of the other protocols in Drexel buildings. Our protocols are no different than what you're used to wherever you are. So it should just be an extension of what you've been practicing all along. Employees that are in return phase 1, it should be 1 through 4 actually, are recommended screening biweekly. So sorry about that, 1 through 4, which means that you are somewhere on campus. And this includes adjunct instructors. As they arrive, automatically they can schedule their test as employees on campus. There is no baseline testing. Please forgive us if we lag a little bit on updating the website behind, but you do not need a negative test to necessarily enter a building. And we're not doing, as we did in the first quarter, all baseline testing for everybody. We've been showing that individuals who work here have a low risk, and also the way that we're coming in much slower than originally planned in phases, again, 1 through 4, not 1 through 5. In 1 through 4, they're coming in over a slow period of time, multiple entry, and it doesn't make sense to do an altogether baseline test. Next. So please download the app. You can check on the symptoms and check in to get that green check to get in your buildings. I have to say that the vast majority of faculty and professional staff have been downloading the app. We still have some students that need to download the app, but it's been going very, very well. It's important. The app is also your gateway in order to schedule a test, as you'll hear about, and to access your test results. Next slide. A word on vaccine. There are overall shortages of vaccine in the city of Philadelphia, but more is coming. The city has been in phase 1A, which includes healthcare workers, those working directly with the virus, such as clinical settings, research settings, and so on. Staff in patient and clinical settings are testing units and healthcare students. I do want to say that Drexel's working with the health department to ensure a vaccine is offered to 1A members of the community. This week, we will be hosting with the health department under their guidance a small clinic for 1A students who are in hospital settings and at risk of COVID, who we want to keep getting their training as they become physicians and nurses, et cetera. And also, importantly, our researchers who are working hands-on with samples of coronavirus of SARS-CoV-2. So that's important as well. And in addition, we still have clinical settings, the partnership care practice, caring together, the hub, other clinical settings where we want to make sure people who work with patients and are clinical facing and at risk have access to vaccine. Having said that, the guidelines from the city remain fluid, and I know frustrating. We all do. As we put out in a memo, as other institutions have done, we're doing our best to advocate strongly for everyone here. We have no indication that vaccine will come to the university for all of those that are here, but if it does, and we're advocating for that, we are ready to distribute vaccine as fast as we can under the phases and the guidance from the city. Vaccine is not mandated, and I remind you that it is emergency use authorization, but not fully FDA approved at this time, although the data on it is very good. Next slide. So moving forward, as I wrap up, what can affect us? City and state mandates that do change according to the viral changes that we're seeing, increased cases in the city, increased disease, or changes in death rates in the city. But these will be public health mandates to us. I stress that our percent infection has been low. We'll hear more again from Dr. Cruz about transmission and what we know from data coming in nationally and locally. Our capacity for testing, case investigation, and contact tracing, as well as isolation and quarantine, also affects operations. You will see changes in the dashboard over time to give you more information about how that's going. Right now, we're fine. And the rate of rise of infection among campus community, should that happen. Obviously, outbreaks at other institutions of higher ed, both in our region and around the nation, will affect our operations as well. Next. So a reminder as I wrap up that there is a Drexel compliance hotline. If you know of a recent situation in which people in the Drexel community may have been exposed or might be exposed due to a health and safety violation, please visit the compliance hotline. You can see the website here. It's linked on the coronavirus page. It's also certainly on the compliance page. And you can click and get concerns answered there. Each of these is received and investigated. And I have to say, that the bulk of it has to do with mask wearing that's coming in now. Not a whole lot's coming in, but this is a line for students to let us know if they're concerned that they hear about a social event that should not be happening, and they're taking the responsibility to inform us. Next. So you'll see these banners all over. Mask wearing remains critically important, regardless of vaccine. If you get a vaccine, you'll still be masking when you're out and in our buildings. Hand washing, mask wearing, dragons wear masks. I'm going to keep saying it as we go on. And now I'm happy to bring on Janet Cruz, next slide, who will be talking to us about COVID-19 screening and testing on campus and a little bit more about risk mitigation. Dr. Cruz?
All right, thank you, everyone. So first, next slide, please. Thank you. So I wanted to start with what we know about colleges. So throughout this process, we've been doing contact tracing, case investigation for our campus since March. We do have weekly meetings with the public health department and other IHEs in the area to get a good understanding of what's happening in our college campuses here in Philly. So a couple things. With all the measures that we've put in place, we're seeing that a lot of the transmission really isn't happening in the workplace. It isn't happening in the classrooms. It's happening where we suspected, right? In home environments, when individuals may be engaging with friends or engaging with other members in small gatherings. So that is our top priority in terms of getting individuals identified, tested, and getting the right education out there. We do know that from other campuses, residence halls tend to be a little bit higher risk. So we have altered our protocols and we have altered the amount of individuals that are staying in these locations for that reason. Entry testing and surveillance testing for our student population is key. And for our employee population, offering testing regularly, to make sure that we're catching individuals that may be bringing in COVID from their home environments. We know that student outbreaks or college outbreaks can trickle down and impact vulnerable communities within our community, within our home environments. And this is why we've stressed bringing in our own surveillance testing here at Drexel. Next slide, please. So I wanted to go over just the multiple layers that we're doing here at Drexel. As I joke with my students, when they see me in clinical settings, I have my homework and you all have your homework. So yes, there is a level of personal responsibility, which we've listed here, and then there's a shared responsibility. I'm going to focus a little bit today just more on the testing end of it, just because a lot of this information, we've presented in different forums. Next slide, please. So the Drexel Health Checker app, this is one of the ways that we want you to engage daily. So one, doing the daily check-ins, especially for individuals that are going to be coming onto campus. This will also help you self-monitor symptoms and give you instructions on what to do next. That's the common question that I get. Okay, I have symptoms, what do I do? Engage with the app, we will walk you through exactly what you need to do. The scheduling for appointments has also been made available through the app. So you'll go in, you'll go under the calendar setting. The appointments will be available to you based on the type of employee that you are, here at Drexel. Same thing with students, based on their type of student, they will have different schedules available to them. For individuals that have been exposed or they're symptomatic, we do have our case investigation and contact tracing team that will guide them on when testing would be appropriate. Next slide, please. So as you can see, once you go into the Drexel Health Checker app, you will be prompted to fill out a survey or a registration. Again, we work hand in hand with the Philadelphia Health Department. So a lot of the information that we're gathering is to help better understand where disease is in our community, as well as how disease is being transmitted. So we do collect some demographic information. This information is shared with the Public Health Department, and internally it helps us understand where our education needs to be and what we're seeing in our community. Next slide. So once you get tested, if you get tested internally through our one of our testing sites, the results will go into your health tracker app. Right now, our turnaround times are within 24 hours. So if you get tested, today, your results will be in your health tracker app by tomorrow. For those individuals that have difficulty seeing the results, or if they have any issues, please contact COVID testing at drexel.edu. So I'm going to go over, next slide, please. Just what the testing looks like. I get a lot of these questions. So if I go to the testing site, what type of test will I have? So we do PCR only for our testing sites. We do a mid-turbinate collection. So right in the picture here, this is where our target is. It is a vast improvement to how we used to do the collections, which used to be a posterior nasal swab. As I mentioned, the results come into your health checker app within 24 hours. That's our goal, and we're meeting that goal currently. For individuals that are asymptomatic, especially for students, it's once weekly. For employees, it's once every other week that we offer testing. Again, an emphasis for when the appropriate time is for symptomatic or exposed. So we want individuals that have been exposed to wait at least 24 hours before they get tested. That's to minimize the chance for a false negative test. For individuals that have been exposed, we want them tested around 5 to 7 days after their last exposure. Again, our case investigators or our contact tracers will walk you through when the appropriate time for testing in those last two buckets. Next slide, please. So what to do with a positive test? So one, if you're tested here through the Drexel testing sites, you will get a call from one of our medical personnel that's part of our case investigation contact tracing, informing you of the test, as well as one of our case investigators to get a better understanding of where you might have been or what your work environment looks like. They will also provide information regarding isolation or quarantine when appropriate. The other step that I would recommend for individuals is, regardless of where you get your test, please contact your PCP. Everyone, your PCP or your primary care physician will know you best. They know what your comorbidities are or what other medical problems you may have, so that if there is additional medical treatments that need to be done because you're now COVID positive, they will assist you with that. For individuals that have gotten tested outside of the Drexel system, I ask that you report. And there's a couple reasons why. One, we want to make sure that we connect you to the right people, that you get the right information regarding isolation and quarantine, and that we connect you with the respective HR business partner so they could get you the right information regarding, an absence from work, et cetera, et cetera. The last piece regarding a positive test. So our case investigators and our contact tracers will walk you through the return to work procedures. Currently, for individuals that have tested positive, we work together with occupational health to get you back to work as soon as possible. Next slide, please. So this slide kind of illustrates how these systems all work together. So from a self-report or maybe a positive test result, our case investigation and contact tracing team will communicate with you, provide information, but also give the university information regarding if individuals were in a workplace, if that work environment needs to be cleaned appropriately. We engage with different systems, including environmental, to make sure that these measures are done in a timely manner. Our case investigators and contact tracers will call people within 24 hours of receiving a positive result or 24 hours of being notified that they might have exposed someone else. Okay. And again, for individuals that haven't tested positive or haven't been exposed, it's going to be key that everyone engages with the Health Checker app for self-monitoring of symptoms. Next slide, please. So I'll entertain questions at the end. I want to present over to HR for updates.
Thank you, Dr. Cruz. Good morning, everyone. I'd like to provide some updates and reminders regarding the campus experience for winter term. So today is Human Resources official on-campus reopening. We are here with over 1,900 faculty and professional staff that are expected to be on campus during the winter term. So that's about an increase of over 400 individuals who were here on campus for the fall. So as we slowly and safely make our way back, know that whether you are on campus or remote, it's your hard work and dedication that really is allowing us to make each transition safely. For those who are coming to campus, I hope you've had the opportunity to check out Drexel Now or the COVID-19 site to keep you updated. Recently, our Drexel Business Services team was able to address many of the questions we have coming through regarding what's open on campus and what to expect upon returning. So whether it's access to the gym or just where you can grab lunch, the January 12th edition in Drexel Now does have all the answers. Of course, you can also find many of these resources on our COVID-19 website as well. When reaching campus, you'll note that parking remains free of charge this term and that the shuttle service is operating along all 3 campuses. For those faculty and professional staff who are not on campus on a full-time basis and they live outside of the city, our payroll department has worked in collaboration with IT to provide you with the ability to adjust your work location percentage. And this certification process will allow you to report the correct percentage each pay and avoid filing for an end-of-year adjustment. If you are in that situation and would like more information, please take a look at the Comptroller's website to take advantage of the opportunity. If this is your first time returning, you'll also receive your welcome bag, along with your Drexel branded face mask, your backpack, as well as personal hand sanitizers. As we move in and talk about compliance, at this time, all faculty and professional staff have completed our safety training and have accepted the Dragon Pledge. As Marla discussed, much of what was included in the pledge to keep each other safe. But if you do come across a concern where our protocols are not being followed, please know that you do have the opportunity to anonymously address those concerns. Dr. Gold described, Drexel's Office of Privacy and Compliance has added a reporting mechanism to the ethics point site. Next slide. So in addition, I did want to remind you of some resources to help you in answering some questions. While I'm not sure that Aubrey and Anna will agree, all of the questions that are coming into the Return Oversight Committee at rock@drexel.edu do help us to ensure that we are addressing and communicating all the necessary information. For those of you who have concerns regarding coming to campus due to a medical condition for yourself, please reach out to our disability specialist to discuss any accommodations that may be needed. And for all other personal questions, you can reach out to your HR business partner for assistance. For those who have children, we know how difficult this time has been. If you have school-age children who would like assistance with homework or with tutoring, we have our new Junior Dragons program is here to provide those resources free of charge. We do have some amazing graduate and undergraduate students who are available for online drop-ins as well as pre-scheduled sessions. And last but definitely not least is just please take care of yourself. With a new year beginning, you have the opportunity to gain your wellness credits and to keep yourself mentally and physically healthy. But if you or a family member are in need of assistance, confidential counseling is just a call away. Or if you're looking for an opportunity to engage remotely with colleagues, please go out and check out our 10 at 10 program. But again, above all else, please take care. And now I'm going to pass this over to Provost Jensen, who has some updates for us.
Great, thanks, Megan. Good morning, everyone. I want to start first by just saying thank you to all the faculty and staff. I think we have over 800 of you on this call, which is terrific. So even though I can't see you, it's great to be connected with you this morning. But I really want to thank you for all your efforts. I know the last several terms have been a challenge for all universities. I think we've responded incredibly well, and it's really thanks to all your hard work. Couple comments I want to make just about winter quarter, and then a couple brief comments about spring. So just a reminder, our winter quarter, due to some changes that had to be made somewhat on the fly, we have a 9-week quarter this term, as we did last spring. The first 2 weeks of the quarter, of course, are virtual, and we will begin our in-person and hybrid classes next week. And we're at about 10% of our classes face-to-face that are face-to-face or hybrid. I do want to remind people that it's very important that even though this is a 9-week format, we have to make sure the content is the same as our typical 10-week class. For most faculty, this means sort of repackaging and using remote delivery to ensure we have that content. We're off to, I think, to a great start so far for the winter. We sent some information out before the break regarding best practices and support for faculty and staff. That included a reminder to make sure we had the courses loaded in Blackboard by January 4th. A reminder about the importance of recorded lectures. This is particularly critical for our students who are in significantly different time zones. I think they've greatly appreciated the ability to have those lectures. On January 27th, our counseling center will be doing a workshop for faculty and staff on student well-being. I encourage people to attend if they can. In addition, our Teaching and Learning Center will continue to provide support via workshop series. And in addition to that, the Graduate College will be able to supply remote course facilitators for faculty interested in that type of support. Next slide. So just a few brief comments about the spring quarter. Academic planning is underway. We are continuing our steady ramp up. I think this is the thing, one of the things I've been most pleased with is since last March, since the shutdown, we have been on a sort of continual steady ramp up of our academic activity on campus, both in terms of research and our teaching. So we are working with the deans and with the registrar and others on the plan for the spring. We will continue to increase activity as long as it's permissible in terms of safety and health. And I think the question that we have is, we focused in the winter on our freshmen and our seniors. We now need to think about our sophomores and juniors as well. So we're looking at whether it's possible to offer at least one class that's face-to-face or hybrid for every student if they choose to have that type of experience. We're also currently working on the spring grading policy. In fact, I'll be attending Faculty Senate later today, where that will be one of the points of discussion. So we should have an announcement about that forthcoming this week, I believe. So that's a quick overview of academic programs, and I think I'm handing it off to Alistair, who can provide a research update. Alistair?
Thank you very much, Paul. Good afternoon, everyone. If I get the next slide, please. So we've had a robust research ramp-up process for on-campus and clinic-based research activities. Here's a complicated process slide to let you know that we've got a robust process for application submission and review. Right now we're in phase 2, that's 66% of regular density. What's different now that we're in January? Undergraduates can participate in ways they weren't able to before, so now they're able to take 4 credit bearing activities as part of research ramp up. They were unable to do that in the fall. On the next slide, you'll see some statistics about those ramp up applications. So in phase 1, it was all new applications, and you see in phase 2 there, it's a balance between new applications and modifications of existing applications. We've had one course application that is a course that utilizes research labs as part of the face-to-face course. We reviewed that. And you can see on the right that pie chart that shows the ramp up requests by academic unit. On the next slide, you'll see the approved research personnel. We've had about 1,200 personnel approved. Half of those are graduate students. Then you can see the distribution of faculty, staff, undergraduates, postdocs, and co-op students. And then finally, on the next slide, my final slide, is a brief update about a partnership you may have seen announced in the Inquirer and maybe on the news. We're proud to be partnering with SEPTA. We rely so much on SEPTA to get to campus and around campus, and for life in Philadelphia, we're proud to be partnering with them on a broad research partnership related to COVID. And this is aimed at really providing expertise to ensure rider safety and reassure their confidence in taking mass transit. So this includes a transdisciplinary team of faculty from across the university. Engineering, I want to thank Chris Salas, who's leading this for the university, from civil, architectural, and environmental engineer, people from the College of Medicine, Dornsife School of Public Health, CNHP, and Westfall, and others. So we've got a broad array of expertise that's represented in this group, and we responded quite quickly to a federal grant opportunity that we hope will be funded, and it has to do with mass transit vehicle air ventilation and purification technology, something that we're all very interested in. And through that, we've learned what SEPTA has done and what they plan to do. So they've changed the filters on the majority of their fleet to be better suited to filter out aerosols that can contain the COVID virus. So this change from the MERV 8 to MERV 13 helps with that that filtration. And then finally, we know that they're evaluating vehicle ventilation. That's obviously very important. You've got to move air through that and through these filters to remove any particulates that may include the COVID particles. So we know that's underway, and the grant, if it is funded, we will be studying that more with them. So we're happy to be lending our expertise to help open up our transit system that so many of us rely on. And with that, it's my pleasure to introduce Subir Shah, who will discuss student life. Subir.
Thanks so much, Alistair. Good morning, everyone. It's great to virtually see all of you today. I'm going to be relatively brief in my comments, just because I want to make sure we have plenty of time for Q&A at the end. But I want to thank, I could take all of my time just thanking so many campus partners in terms of the reactivation of campus and bringing undergraduate students back to campus. Our move-in week commenced on Saturday. And in a typical year, many of you know, we have close to 4,000 students who live in Drexel housing, which is our residence halls and Greek properties. This year, for a variety of different reasons, that number is closer to 1,000. We've implemented a lot of different pieces from a health and safety perspective. Students don't have roommates, they'll have their own rooms. We've put aside certain halls for quarantine and isolation spaces. We've put in social distancing measures, and common area spaces eliminated furniture. But with all that being said, we still have a fair number, like I said, about 1,000 students who are excited to come back to campus. We worked with our external partner, USS, who helped move in about 500 of those students to campus this weekend. We coordinated with Dr. Janet Cruz and her team. From a student health center perspective, all students received the COVID test before receiving their key to move into their spaces. The weekend went remarkably smooth. And there's, like I said, so many people to thank. I want to thank Dr. Mackenzie Luke, our Associate Vice President for Student Success, and Katie Zamielinski, our Associate Vice President and Dean of Student Life, who oversaw many of the efforts as it related to move in, Katie specifically in working with the Residence Life team. So we're excited to bring students back to campus. We have the rest coming in for the rest of the week during this quiet period before moving into in-person classes for next week. Campus is reopened and reactivated, so many of our spaces are reopening for students to use. Again, much like our common area spaces and the residence halls, a lot of social distancing measures in place. There'll be some limited hours, but we want to make campus feel as active and lively for the students that are here. And it's good to remember that in addition to the 1,000 students living with us, we have about 2,500 who live in our American Campus Communities properties. ACC, we're proud to say, in coordination and partnership with us, continue to offer rent abatement to our sophomores who are bound by the 2-year residency program. Between 700 and 800 students took advantage of that opportunity, which limited their occupancy on the ACC side. And then we have several thousand more who live in the surrounding community. So we do have a lot of students in the area, and we want to make sure that they have an active campus life and can get used to campus with health and safety driving us. Some of you have asked about our rec center. Our recreation center is opening up next Monday, again, following the same parameters that we had before with limited occupancy and folks who can sign up to come in and use the rec center. It's a good transition point into athletics, and I want to recognize and thank Dr. Eric Zilmer and his team on the athletics side. Our varsity sports, many of them are back in motion. Our men and women's basketball team have been active and in season. They're going through daily testing and doing great. I'm really proud of the men and women's basketball teams and their coaches. We're working closely and hand in hand with the Philadelphia Department of Public Health and following their guidelines as it relates to testing and just the overall protocols for our athletics teams. So we're really excited, in terms of welcoming our students back to campus. Like I said, I wanted to be brief in my comments so we'd have plenty of time for Q&A. And with that, I want to transition and welcome John Chase, our Executive Director for Environmental Health and Safety, who he and his team have been just exceptional in terms of making sure that our campus areas are open for our students, faculty, and staff. John?
Thank you very much, Sabir, and welcome everybody. My name is John Chase from Environmental Health and Radiation Safety, and I will be speaking today on behalf of not only my unit, but Dan Severino and facilities. Before I get started, and I do want to be brief, I just want to say a quick thank you. The leadership and the cooperation of this group has been amazing, and I just want to say thank you to all of you. Today I'll be speaking in reference to what's open for the winter term, focusing specifically on classroom areas. We have 249 spaces that we're going to be using for classrooms. This includes all campuses and our lease locations. I'd like everybody to know that we've done a full assessment on the HVAC systems servicing these areas. Some of that assessment is done by third-party engineers, and other portions of it were done by our in-house professional engineers. The systems, to the extent possible, have been reprogrammed and or manually set for enhanced service. We would be following the ASHRAE, that's the American Society of Heating, Refrigeration, and Air Conditioning Engineers, ASHRAE's 62.1 recommendations for occupancy during a pandemic, as well as CDC and DOH guidelines. Of those 249 spaces, we found that 90 of them, that's about 36%, needed supplemental treatment in the form of standalone HEPA filtration units. We currently have about 119 units deployed in those spaces. We also have signage on all these areas. We have stickers that say sit here, don't sit there, and buckets of sanitizing wipes have been stationed in each area as well. Additionally, we have 42 spaces for independent workspaces, independent work and or independent study. Some of these are controlled by individual colleges, but most are available through the library's space reservation system. I would encourage you to check those out. All of these areas have been assessed and treated as noted above for the classrooms. All of our entrances, stairways, elevators, restrooms, classrooms that are scheduled for use, and other forward-facing areas have been provided with certain types of signage noting maximum occupancy, reminders to wear masks, hand hygiene, social distancing, stickers noting, like I said, where to sit and not to sit, in some instances where to stand, in bathrooms, which urinals or sinks to use, etc. And plexiglass barriers have been installed in all of our forward-facing areas, at least with the groups that we've worked with so far. We've also made sure that hand sanitizer is readily available. It's most notably present in entrances to buildings and in elevator lobbies. Although the team has put together tremendous efforts in trying to make our spaces as safe as possible, I just wanted to take a moment and acknowledge the fact that we're not perfect. If we have missed anything, if something seems amiss in your particular area, please reach out to us and let us know. Next slide, please. I'm giving you all my email here. Please make note of it. If anything seems out of order, please get to me. It's our true intent to want to make the areas as safe as possible. And I just want to say thank you to all of the groups that have worked with us so far. I'm going to cut my presentation there and turn it back over to Anna for questions and answers.
Thank you, John. Good morning, everyone. At this point, we'll open it up for questions. We have received some questions in advance. We'll begin there. Please feel free to post any additional questions or thoughts that you may have into the chat here. We hope to get to these. We appreciate everyone's patience through this. So I'm going to begin with an academic question for Provost Jensen. Why isn't there a unified plan to send staff, specifically academic advisors, back to work or decide to keep them remote if they are not interacting with students? Paul?
Thanks, Anna. I think, in general, we are trying to take university approaches to everything we're doing, and your question is specific to advising. I think part of the challenge is every college has potentially a very different situation in terms of the nature of their programs, whether they're lab intensive, studio intensive, or clinical based, et cetera. Very different facilities, different numbers of students, different numbers of advisors. So I think the most important thing is that every college is going to follow, the health and safety guidelines. But I think it's because of the differences across colleges. I think you're going to see often differences in the approach taken. So we do try to be consistent, but sometimes it's just the situation that calls for a different solution.
Thank you for that. The next question is a health and safety one. The question came in that says, I've heard that some on-site organizations which are participating in regular COVID testing have determined that they will return to being fully remote should their positivity test rate hit a particular threshold. Is this something that Drexel is considering? Marla?
Thanks for that. We are not considering a set threshold for the change because it's a lot more complex. So what I would say to you is among the things we look at is not just the percent, but also the rate of rise, our ability for isolation and quarantine, where those cases or individuals are, and any information we get with the city. So if numbers begin to rise or we feel that we have an issue, a cluster, anything like that, we would be partnering with the health department and working together, make our decisions from there.
Thank you for that. A question has come in, and this might be for Dr. Cruz. Will employees be notified of a direct exposure? Dr. Cruz, it might be helpful, perhaps you can walk us through what the process looks like when somebody is informed that they are positive and they are at work.
Sure, no problem. So this is the big part of what our case investigation and contact tracing does. So they'll call anyone that's been, identified as being positive. They'll walk these individuals through when their infectious period was. So just for everyone here, it starts 2 days before the start of symptoms or 2 days prior to a positive test. And they'll walk through literally what that individual did during that infectious period. We have a contact tracing team that will then notify any individual that may have been in contact with an individual that was positive. The notification will be anonymous, meaning a lot of these exposed individuals will get a phone call saying you were exposed on this date. We don't reveal who or exactly how the exposure happened. And then those individuals that have been exposed will be given education on how to quarantine. Our contact tracing team will assess if they can quarantine safely, meaning they must have their own bedroom and their own bathroom, and then when to test. Thank you, Anna.
Thank you for that. The next question is actually regarding facilities. So have air exchange rates in classrooms been quantified, and hopefully have they increased? And if so, at what air rate exchange?
So,
John.
So as previously noted, we used some in-house and third-party engineers, but I also want to give a shout out to the College of Engineering, Chuck Haas and Mike Waring, who worked with me specifically and individually to take a look at the way that we were doing these assessments and to see if our approach was sound. In essence, it varies, but our target for the amount of outdoor air per person ranges from 7.5 to 10 CFM per person, depending on the utilization of the space. And our air changes have a target of 6 air changes per hour or air change equivalents. That number will be slightly reduced in areas that have extremely high ceilings because of the mixing and just the data behind that. If you have any further questions, please feel free to reach out to me and we can talk further.
John, some additional questions have come in. If somebody wants to review the actual specific workspace that they're in, is it safe to assume that they can reach out directly to you for any questions?
Yes, please. I've been trying to get that word out to the masses. If people have concerns or questions about their individual spaces as they come back, please get to me. We want to work with them.
Okay. The next question is about the student experience. Is the student college experience being prioritized over the health and safety of employees? I'm going to turn it over to Subir for this question.
Thanks, Anna. And I'm happy to start. I might ask some of my colleagues, maybe Dr. Gold or Dr. Cruz, to weigh in as well. Here's what I would say about the student experience. We have been consistent since this whole pandemic started. And it's important to note that we've had graduate, medical, and law students on campus since the fall. We're just expanding that to increase numbers as it relates to the undergraduate side. Health and safety has always been our primary driver. So, as I said, in a typical year, we have close to 4,000 students on campus. That number is closer to 1,000. In a typical year, students have roommates. This year, they have their own spaces. Our campus spaces are open, but with social distancing and in terms of occupancy numbers in mind. And then we put in policies around students having to follow no guests in the residence halls. Even this weekend, as students were moving into campus, parents and families weren't allowed into the spaces. That's part of the reason we had our external service, so that students wouldn't have to worry about carrying a lot of boxes in. And so, everything that we're doing is really driven with health and safety in mind. Again, I don't want to speak for Dr. Gold, but I think for all of us, we would not be taking any steps that we were taking if we felt like we were putting anyone in our community at danger. We feel good about our testing systems in place, and we believe in our students. We believe that our students who are coming to campus will follow the policies and rules that we set out. For the students that have come, we've had success in working with them in terms of having them wear masks, having them socially distant, not engaging in large groups, and when issues do come up, we're able to address them, whether it's through student conduct or through one-on-one conversations. So I do feel good about the numbers of students that we're bringing back to campus and how we're engaging with them. Dr. Gold, I don't know if there's more you wanted to add there.
Thanks, Subir. I don't think so. I think that you have it covered, and I think Dr. Cruz's comments about where transmission is not seen and where the issues are, again and again, for all of us, for students and for professional staff and faculty, where we are seeing infections, they are tied to social gatherings, small mixing of households, and things like that. And that is what we're really focused on in terms of the information that we give. I want to make sure we leave time for questions. Jen, is there anything you wanted to add?
I did. I just want to emphasize a lot of the students are very receptive to the education that we give them. And a lot of times they will present. So one, they present very early, meaning they have a sore throat this morning and I'm already hearing it, in the clinic. So they're very receptive. They're very engaged. And if there are other people that have been involved or they might have exposed, they openly share that. I haven't had a huge issue with compliance at all. If anything, they'll say, hey, I might have exposed this person. It's also a Drexel student. Can they come to the site? Can they come to student health as well? So I think they have been very engaged. And I think there's an understanding that college is going to be a little bit different. And they are coming up with creative ways to interact that doesn't involve face-to-face. So I think we will be pleasantly surprised with our young adult population.
Thank you, Janet, for that. A question has come in for HR. Now that many staff members have proven that they are able to fully work remotely, will permanent remote or mostly remote options be made available to individuals? And to piggyback off of that, Megan, for employees who can feasibly continue working remotely for an indefinite period of time, can we opt to remain remote? What is our stance on this?
Well, thank you, Anna. That was a fairly lengthy question. So let's talk about the current remote options. Very quickly, we were all forced to work remotely, but for many years, we have had a flexible work arrangements policy in place at the university. It was utilized probably more sporadically, and there's lots of opportunity for flexibility, including remote work. As we start to look at what this post-pandemic world will look like and how it will impact us at the university, these are conversations that have been occurring with the senior leadership team. In fact, we have many areas currently working across the university to develop a white paper to be presented to cabinet to find ways to expand our remote work opportunity. As you stated, there are quite a few benefits in doing so, both from an employee perspective and the flexibility of working remotely, as well as from a university perspective on space allocation that we need. And Anna, did that answer the full question?
I believe it did, Megan. I believe so. So a question has come in regarding vaccine. Quite a few questions actually have come in regarding vaccine, Marla. I'm hoping maybe you can expand a little bit more beyond what you said during the presentation. Questions arising as to whether or not it is required for faculty and professional staff and students, as well as whether or not people should wait until there's one dose vaccine rather than getting 2 doses, as well as if someone is actually vaccinated, do they have to wait to get both doses and continue to be tested? So maybe you can expand a little bit more on who's eligible, what the process looks like on campus, please.
So thank you for that and the questions about vaccine. First, vaccine is not required. It's not mandatory for anyone in the campus community, and it's not mandatory for any population anywhere in the city of Philadelphia that we know of. Second, Drexel's not making the decisions of any phases. The phases and who's in them, because we're in Philadelphia, are being guided closely by the Philadelphia Department of Public Health to us. Third, anyone who has access to vaccine or is being vaccinated, again, we do have a limited amount of vaccine for 1A. Because we don't have a central hospital, we went to the city directly for our 1A people, whereas the other institutions of higher ed had their vaccine come in through hospitals and then to their 1A individuals that I mentioned earlier. Anyone scheduled should absolutely have both doses of the vaccine. And in most cases, in fact, in all cases, when you go to a vaccine clinic, you're given an appointment for your return vaccination. So you should have both doses. If you're fully vaccinated, or in the middle, regardless, people who are fully vaccinated still remain in our testing program. We still advise you to get tested. And in addition, if you are vaccinated, you must still wear masks. There's no evidence yet, the studies are not out yet as to whether or not a vaccinated person is still able to transmit virus, even though they don't get clinically sick. So you don't have any symptoms, you feel well, but you still may be able to transmit. So you're still mask wearing. And the reason for testing is that these are really good vaccines. In both cases, the two that are out there, Pfizer and Moderna, are up to 95% effective, but that still leaves upwards of 5% who still contracted the virus. And therefore, we're going to continue to offer testing to that population. Thanks.
Thank you for that. An additional HR question has come in regarding whether or not we're looking at an additional phase, perhaps a phase 6, or will everybody be required to return in the spring? And to expand off of that, Megan, when is the decision date really made for the spring term? Many individuals are curious as to whether or not the April date is set in stone and how that decision is made.
Thanks, Anna. So as we've seen, I think our key topic is that we have to remain flexible, and whether we're building plans to move forward and address spring term with reopening fully of campus versus having to pull back and do a slower phased in approach. We haven't yet made that decision. Marla may want to comment on this as to what's being considered through the Return Oversight Committee. But at this time, those faculty and professional staff who were asked to continue to work remotely did receive a letter stating that they were expected to return for spring because that was the latest phase. There's definitely opportunity for continued phases depending on how the rollout of the vaccine and our opening of campus occurs. Marla, is there anything you'd like to add?
Not at this time. You know, the nature of COVID, and I'm watching the clock here on questions, is that things are fluid and they change. Right now, we assume that in the spring, as it warms up, we'll be able to even allow more populations back on campus, but we're working through that now.
Marla, thank you for that. I know that we've come up on time here. We will be reviewing these questions that are submitted with name that are not submitted anonymously, and we will respond to your questions. For those that may have submitted their questions anonymously, please feel free to email us at roc@drexel.edu. We're also very open for any suggestions that you may have to the COVID website should you require additional information. As we close out here, Marla, I'll turn it back over to you for some closing remarks.
Thanks, Anna. I just want to thank everybody here today. I know we've done lots of town halls. Some people think we don't say enough. Others wish we wouldn't say so much and leave more time for Q&A. It remains a relatively fluid situation. I see a number of questions coming in about variant and concern. I can say that we share your concern, and again, working with local, state, and federal health departments, we put health and safety first. The guidelines for us and Penn, who are also onboarding actually even more students than we are right across the street, literally, is that we are looking at the percent positivity and what we can do in terms of isolation, quarantine, and care, mainly for our younger population, and always watching that there's no spread that's going on inside campus buildings, which no one has seen throughout the city. So please know that we have an eye on that. We've moved very slowly. We continue to move that way. We're doing everything we can to make things as safe and healthy as possible. And of course, you're part of that. And we depend on you to continue to follow our protocols as we bring more people back to campus. Thanks.